Hello and welcome to PA113, week 8. This week we're in chapter 10, and so we're going to do a little bit of lecturing on that. So I'm going to do that, and then we're going to talk a little bit about your discussion question, which is about tuberculosis. So starting in chapter 10, we are on page 153. I'm talking about pulmonary drugs, bronchodilator drugs, and any pulmonary, pulm meaning lungs. So anything that you see that has pulm in it, you'll know that it is dealing with your lungs or something to do with breathing. All right, so it talks about bronchodilator drugs with asthma, COPD, emphysema. I'm sure you've all heard of these type of diseases before. Bronchoid, excuse me, I can't even pronounce it. Bronchodilators, bronchioles, that kind of stuff is what we're talking about. Page 154, you see your first picture of the inhaler there. And then they have listed a lot of the different inhalers there underneath. Inhalers can be used for asthma, they can be used for allergies, they can be used for even if someone has a cold, sometimes the doctor will give them an inhaler just in case they need that. Here's a Cervant, Spiriva. And Spiriva is a little bit different because it's actually a capsule that is pulverized inside the inhaler, and then the patient breathes it in and it is in their lungs. So that's a little bit different for an inhaler because usually it's just air out of a canister, but Spiriva is a little bit different as it is a pulverized capsule. It goes into corticosteroid drugs. We know what steroids do is to decrease inflammation. So like with corticosteroid, you're talking about someone with maybe an asthma problem who needs to decrease the inflammation in their lungs so that they can breathe. They talk about Advair as well. And then we go into the capsules and tablets that people can take to breathe easier. Singulair is one of those, 10 milligram capsule, and it's once a day. It comes in a 30 tablet bottle, so sometimes you can just label that bottle and give it to the patient that way. You don't have to even open it and waste a pharmacy's container. You can use the Singulair container. You can just put your label over that if that makes sense. They also talk about respiratory infections, and then here are drugs used to treat tuberculosis. Tuberculosis, often TB, is caused by Mycobacterium tuberculosis. It's a gram-positive bacterium. Tuberculosis is spread by an airborne droplet expelled by coughing. And if you can remember, was it just a couple years ago that they thought they had a TB outbreak here in the United States because somebody had coughed on a plane and they thought that she had TB. I think it was a nurse, and everyone was having to get tested for TB. If the patient's immune system is strong, the infection can remain dormant for years without causing a symptom. And that can be really scary because of, again, if you're on a plane and you're exposed and then your immune system is not compromised until years later, and then you might have TB. Because of a unique waxy coating around its bacterial wall, tuberculosis is difficult to kill and resistant to antibiotic drugs that are effective against other gram-positive bacteria. Treatment of tuberculosis is accomplished with a combination, not just one, of these different medications, and they've listed them here for you so you can see that. And then there are some secondary antitubercular drugs, most commonly used to treat multi-drug resistant tuberculosis, or MDR-TB. And if you know anything, if you worked in a hospital, if you worked in a nursing home, then you know that we are getting some resistant bacteria, and tuberculosis has been one of those. And so they've had to come up with other medications that will help to defeat that. And so they talk about the combination drugs down here as well. I wanted to read focus on healthcare issues. The tuberculosis bacterium has developed varying degrees of resistance to most anti-tubercular drugs. Resistant strains develop when the patient is not compliant and does not take the anti-tubercular drug for prescribed length of time. To minimize the chance of resistant strains developing, they are given a combination, and patients continue to drug for the full 9 months. So whenever, this is even to do with any antibiotic that you've given out, that they take the full dose. Although you may feel better in 3 days, please continue to take the entire 7 days that the doctor has given you, because that's how the bacteria comes back. It gets used to the drug, and then it starts fighting the drug. And so then people aren't able to take the same drugs to kill the same bacteria as we used to. And so we're having to come up with resistant strain bacteria drugs. And this is what they're talking about with the MDR-TBs. Let's see, being compliant. Patients need to be compliant. Directly observed therapy, the DOT, in which the patient must come to the clinic each day and be observed while actually taking each dose. In San Francisco, which was the highest TB rate on the West Coast, the Attorney General can order non-compliant patients to remain in their home except for doctor visits, or even send them to jail while their treatment is continued. So this is such a controversy and such a something that the CDC calls for patients to be compliant, and so they'll make you go to the clinic, take your drugs in front of those doctors, and make sure that you're getting well and taking the full dose. So I just wanted to make you aware of that you also tell the patients, patients around you and patients that you're dispensing to, that they take their full dose of antibiotics. And then, so that helps answer your discussion question, why are combination drugs now used? Let's talk about that. If you can reference an article maybe about people who have had TB and they've used the combination drugs, that would be really helpful, because we could all get in a discussion about that. This is a class discussion, so make sure that we're using it that way, that if you were to raise your hand in class and I would to call on you, then you would say, hey, I read this article and this is what I have to add to the discussion. Giving me the definition of tuberculosis or giving me the drugs that they use is not quite a discussion. Okay, thank you for the information, but I can't discuss with you in that way. So make sure that you're adding something like that so your other peers can help you in that way. Expectorant drugs is the Mucinex, and drugs used to stop smoking, Nicoderm, nicotine drugs, other drugs for smoking cessation. They've got those listed there, and respiratory distress, so you can read a little bit on that. Remember that at the end of your chapter, you will do the quiz yourself and clinical applications, making sure that you're reading those handwritten prescriptions at the bottom so that you can see what type of abbreviations we use with inhalers, and so puffs is one of them. And then don't forget, on page 166 it goes all the way to 5. So clinical applications, there are 5 questions on there. Don't forget, because they're on a different page. All right, I think that I've helped you answer those today. I hope that you find this interesting. I would love to hear back from you guys. If I need to answer more questions, I would love to do that. And hope to talk to you soon. Thanks. Bye-bye.